Hello everyone, my name is Melanie Pescud and I would like to acknowledge the Whadjuk Noongar people upon whose lands I'm recording this presentation from today. I extend my gratitude and respect to all of the elders, past, present and emerging. And on behalf of my colleague, Professor Lucy Wright-Chetnik, I will be sharing this presentation with you, which we have called Addressing Complexity in Prevention Research, the Dynamic Duality of Systemic and Systematic Approaches. While it's widely recognised that there is a need for systems thinking to address complexity in chronic disease prevention, at the same time, there is insufficient understanding of how such approaches are operationalised in prevention research. And so this is what we sought to do in this study. Eisen and Straw proposed that in order to address complexity, the right balance must be struck between systemic and systematic paradigms. Systemic refers to things like exploring the bigger picture, a focus on the whole and interconnected parts, natural experiments, and having a focus on strengthening existing systems. Whereas systematic refers to a focus on the details. It's methodical. It involves an exploration of parts and the focus is much more linear. With both systemic and systematic paradigms in mind, we examine the relationship between systemic and systematic ways of working in a series of 6 case studies and present how this was operationalized across different forms of prevention research. We also present an expansion of Eisen and Straw's heuristic to further describe and illustrate the multi-layered interplay that was observed across and between systemic and systematic paradigms. Our case study topic areas included prevention research related to food and nutrition policy, obesity prevention, livability, and health services research. The case studies also applied different study designs and research methods. Data collection included 29 semi-structured interviews with 16 participants and an analysis of project-related online documents, including project web pages, findings reports, blogs, and journal articles. And we conducted a multi-stage analysis that combined inductive methods, drawing on grounded theory, and a theoretically informed framework analysis. We found that in order to address complexity, all case studies used both systemic and systematic paradigms. And these played out in different proportions. Some were more systemic and some were more systematic. This continuum is illustrated here. So work may sit on the far left or the far right or somewhere in between. Systemic and systematic ways of working varied across each case as a whole, and that's what we're calling the first order metric, but we also examined the case studies along a number of dimensions which very roughly comprise the whole. And this is by no means an exhaustive list, and these represent the second order metrics. These included the reported theory, methods, relationships, capacity building, learning orientation, multi-perspectivity, and knowledge mobilization. We found that the balance of systemic and systematic paradigms therefore varied within each of these dimensions. So if you were to judge a study by the theory and methods alone, it would give a misleading picture or assessment of the work. To take this idea further, take a look at this diagram. This represents a hypothetical case study of prevention research and depicts the increasing boundary scope moving from looking at the case study as a whole, the first order metric, to looking at the case study in terms of its component dimensions, the second order metric. Looking at this figure, we can see that if we judge a case by its theory and methods alone, then we will see it as more systematic in nature. Whereas if we bring in the additional dimensions, we can see that overall it's more systemic. By widening our perspective of each prevention research case, we can deepen our understanding of the range of systemic and systematic dimensions comprising the work. So an important finding is that unless we expand our boundaries, most notably beyond theory and methods, we may not notice if we're making surface level judgments, and we may not notice the true degree to which something is systemic or systematic. Thus, by expanding the boundary, our perception of different chronic disease prevention research case studies will change. So to conclude, we suggest that there is inherent value in being more explicitly conscious and bilingual in both systemic and systematic paradigms, so that their respective value and strengths may be utilised. Our findings propose a coherent theoretical frame to better understand existing approaches for addressing complexity in prevention research, and thus empirically advance the prevention of chronic disease. Thank you very much for listening, and please do get in contact if you have any questions or comments you'd like to share. Bye for now.